Welcome to the Sporting Chance Forum 2021, brought to you by the Center for Sport and Human Rights. Please be sure to follow the Center online at sporthumanrights.org and on LinkedIn and Twitter at Sport and Rights. And don't forget to use the conference hashtag SCF21. The COVID-19 pandemic has impacted the physical and mental health and well-being of billions of people worldwide. Athletes and those working in and around sport are no exception. Since early 2020, the sporting calendar has been radically disrupted, with events canceled or postponed, sometimes indefinitely. Where elite sport has resumed, it has done so fundamentally changed, with athletes competing before empty stadiums, subjected to quarantines, testing, and other unfamiliar constraints as well. This session is dedicated to examining the human rights impacts and risks associated with the pandemic on sport for those on the field of play and those who work to build the infrastructure needed to create the field of play. We'll start by hearing about how children, then athletes, are and have been impacted. Then we'll look at the impact of the pandemic on labor rights in professional sport and sport leagues. What worked, what didn't, and why? And finally, we'll pivot to look at how the pandemic has impacted those who are working to prepare to host a mega sporting event and see what learnings can be gleaned for those who are or will be preparing to host sporting events in their host cities. I'd like to start by sharing some information about what we know about the impact of the pandemic on children in sport. The Center conducted a study on child athletes' views on the impact of the pandemic on their engagement with sport. When we did so, one of the recommendations of the study was to contact children and youth to learn directly from them what their experiences and perceptions about sport were during the pandemic. In response, between December 2020 and April of this year, the Center partnered with sports bodies and sport for development organizations already working with children on a survey. The survey was distributed in 6 languages: English, Spanish, French, Portuguese, Vietnamese, and Lao. Responses were completely anonymous, and a total of over 1,600 responses were received from children and youth from the 5 continents. Of the children who responded, about half were engaged with sport for development programs, and a third were part of an organized team or club. So what did we learn? The survey revealed that children in sport are being impacted in many ways by the pandemic, and that these impacts have the potential to leave significant consequences in the long run. For example, 80% of the children reported feeling affected, that is physically or mentally, emotionally, or both, by the fact that they can't do sport the way they used to. Nearly half of respondents indicated that they miss sport more than anything else. Our report on the outcomes of this survey is not yet available on our website, but will be shortly. Please look for it. So with that lead in, let's explore the impact of the pandemic on health and well-being in sport. We've got a super panel today. We'll start with Hannah Wilkinson, who's a professional football player for the New Zealand women's national team and for Melbourne City FC. Hannah is a 3-time FIFA Women's World Cup participant and a 3-time Olympian, competing in the 2012, 2016 Olympic Games, and most recently in Tokyo 2020. Welcome, Hannah.
Thank you so much for having me.
Terrific. Matt Graham is the Director of Legal and Player Relations for the World Players Association. The World Players Association is the leading voice of organized players in the governance of world sport. It brings together 85,000 players across professional sport through more than 100 player associations in over 60 countries. Welcome, Matt.
Thanks, Mary.
And finally, Stefan van Dijk is the Senior Health and Safety Manager in the Workers' Welfare Department at the Supreme Committee for Delivery and Legacy, responsible for the Qatar 2022 FIFA World Cup. Welcome, Stefan.
Thank you, Mary.
So let's start by looking at the impact on athletes. Hannah, for those of us who are trying to understand what it's like to be a professional athlete, an elite athlete, and you're trying to go to work, you're trying to prepare to compete in something like the Olympic Games in the middle of a pandemic. How's it different? bring it to life for those of us who are trying to imagine what it's like.
Yeah, I think, like anyone, it's psychologically difficult to have, own purposes put on hold because of this. Everything has to stop. Everyone has to get locked down. But what I've found, as being part of a team, getting ready for an Olympic Games in a sport like football, immediately you're separated from your teammates. Immediately you're isolated. That's already really difficult. And then all of a sudden, it's almost like you've paused all of your training. You just simply cannot train the way that you need to and the way that you want to. You have to be out there training with your teammates day in and day out to get that success on the field, and that just simply cannot happen. You're kind of limited to just keeping yourself fit, and it's usually just with these 2-week-long hotel quarantines that I've done far too many of. It's just you're limited with a bike. So I really did, as someone that's been through a series of injuries myself, I did relate it to an injury, but it was almost like worse in the sense that at least with an injury, you have a sort of period of time where you'll be coming back to the field. Whereas with this pandemic, I think the biggest trouble is the uncertainty around it and the indefinite period of time that you're stuck in this strange place. And so, it's been very difficult. And I think if you spoke to any athlete, they would say the same thing. It's, I think, physically it's difficult to stay on top of things, of course, but 99% of it is your psychological state and your sense of worth. Everything to do with being a professional athlete, you're kind of stripped of something just that little bit. So it has been very difficult.
So one thing that you brought out when we were talking before that I thought was really interesting is as an elite athlete, you're always looking for a competitive edge, right? You're always looking to see how can you what's going to make the difference. And with the pandemic, you had a difference in country protocols, right? So some countries were locked down, you couldn't do anything, and others were more open. So their athletes had greater opportunities to basically prepare. Tell me a little bit about that.
Yeah, exactly. So that's the kind of the situation that I'm in. I'm in New Zealand at the moment, and New Zealand, Australia is still very restrictive with where you can travel to. Like there's a lot more lockdowns happening. Basically, if you leave New Zealand, you can't really come back because the country's basically sealed up. But overseas in Europe, they're starting to open up more, and so there's all these different levels of freedoms. And ideally, if you want to be performing at the absolute best right now, it's Europe right now. Because the leagues are still carrying on like normal. And so, there's probably a series of my teammates are, feeling like maybe they're dipping a little bit behind in terms of, making spots for squads and like dipping behind in terms of bettering themselves as players to make those squads for major tournaments. And it gets to be like, if you're in a situation that you can't control and you're just locked down, you feel like you're trailing behind a little bit. And that just adds more to that psychological stress because most of it is about what you can and can't control. And if you can't control it, you really the first thing you have to do is just kind of let it go. As a professional athlete, you end up realizing there's a lot about the sport that you can't control, especially football. There's bad referees, there's weather, there's all kinds of things you just can't control. But if you can control your effort and your intention and everything, then that's what you really have to focus on, right? But with this sort of situation, when there's this much out of your control, you can't help but let it kind of sink into your psychological state just that little bit, and you want to be able to control a little bit more there. And that's when it starts to get super stressful and super hard.
So last question before we go to Matt. Let's continue about mental health, right? So we've heard a lot more. Michael Phelps has been talking about mental health for a long time. Then Naomi Osaka, Simone Biles, right? Just talking about the mental health challenges that athletes navigate in normalcy, right? When things aren't in the middle of a pandemic. And then you throw in the pandemic. So, what did that challenge look like for someone who's been inside it? You already mentioned a little bit about this, but what do you think what do you want people to know about kind of what it's like to go through those sort of mental challenges when you're in a situation like what you've been through?
Oh, I think it's just the whole part of being like a professional athlete, as I said before, it is 99% mental. If your mind is not quite right, you're not going to perform. Like, it's as simple as that. So when you layer a lot of that pressure and that stress already with competition and what it takes to be the best, a pandemic's kind of sat on top of that. It just, it's a recipe for disaster. So, it has certainly been a test of mental resilience these times. And I think, for Team New Zealand, when we played in Tokyo, New Zealand was one of the most affected countries by this pandemic in terms of travel restrictions. And so we as a team couldn't play any matches for a year. We actually had about 2 weeks to prepare for those Tokyo Olympic Games. And so
okay, that's
me,
crazy. I mean, you didn't play together for a year, right? As a team.
Mm-hmm.
And then you had 2 weeks before you went to the Olympics where you could train.
It was about 2 weeks of preparation together as a team before we played America, Australia, and Sweden.
The group of death. Basically the group of death at the Olympics, right?
Right. So I think the biggest way I can sum it up is I was just so frustrated, because we didn't really get the chance to. I know it's tough opposition, but we didn't really get the chance to really show what we could do against these teams, because we simply didn't have the preparation. You just cannot perform if you're not prepared, and we suffered a lot. And the biggest word there was frustrating.
Yeah. Okay, thanks, Hannah. Matt, I'd like to come to you. We've heard from Hannah what it was like, to be an athlete, professional athlete, trying to prepare and compete in this kind of environment. But, when COVID hit, it was chaos, right? And live sport just sort of from one day to the next just shut down. And then slowly we saw return to play. And, from your place at World Players, you lived through this. And what I'd love it if you could share with us what it was like and what were the key human and labor rights issues that were at play from your standpoint. Matt, over to you.
Yeah, thanks, Mary. Of course, throughout the course of 2020, the word unprecedented was used so frequently, it almost became a little bit of a cliche, but the impact really was truly enormous. And I think it's also worth bearing in mind that those impacts are still very much ongoing, and our thoughts are, of course, with those who are still being impacted and affected by this dreadful pandemic. But if we go back to March last year, within the space of a few weeks, I think, as you alluded to, we had the Euros postponed, we had F1, NBA, NHL, AFL, NRL, countless other sports all suspended or postponed. And then, this was followed by the Olympics, which somewhat reluctantly and belatedly was also postponed following advocacy from athletes, player associations and sport and human rights groups at the time that if the Tokyo 2020 Olympics were to go ahead, it may just exacerbate the ongoing public health crisis, which at that time was only a couple of months away. So given this kind of dramatic pause, the fundamental question for us was, what must be done to support return to play, the resumption of the industry in a manner consistent with public and athlete health in the face of this rapidly spreading virus, where there was very much, there was a lot unknown about. And I'll come to that because I think that's really interesting how we navigated and negotiated that process. But before I do, I just want to pick up on your point on the key sort of labour and human rights issues. And the first, of course, was occupational health and safety. And when we talk about that, as Hannah's just sort of really eloquently put as well, we're not just talking about physical health, but we're also talking about mental health. And the utmost importance of occupational health and safety is really being emphasised as a consequence of the pandemic. There's now a push by Uni Global Union, which World Players is part of, along with other global union federations, to have this recognised as one of the ILO's fundamental labour conventions. And that's crucial, as it will really enhance obligations on governments to ensure these standards are available for workers worldwide. But the second key human rights challenge is the wider issue of decent work. And it's appropriate that we're actually having this session today on the World Day for Decent Work, because we haven't just been facing a public health crisis, but we've also been facing an economic crisis. As part of that, the shutdown of the industry for athletes meant many athletes couldn't work. Many athletes suddenly weren't getting paid. It exacerbated widespread problems in sports such as football in relation to late and unpaid wages. One of our affiliates, EU Athletes, did a survey of its members, and 45% of EU Athletes affiliates had cases where player contracts had been unlawfully terminated or unilaterally sort of changed. And I think the other thing...
Wait a minute, 45%?
45% of their affiliates, yeah, that's right.
That's huge.
So this was at the beginning of the pandemic, and it's worth noting that, it also set back some of the progress in relation to gender equality. Before the pandemic, women's sport in particular was making really positive progress. But when the pandemic hit, men's sport, that was initially heavily sort of prioritised. So we've got these kind of health and safety challenges, and then we've got these wider decent work challenges. So the question then became, what did we do to overcome them, and what was the key to that? And, the answer there really was the enjoyment of the right to organise and collectively bargain. I think here the experience was that where athletes were represented by player and athlete associations, they were able to negotiate robust protocols that protected health and safety, but also meant, sport could get back and it could start making money and getting income into the system. Again, where the athletes weren't well represented, they were exposed to unacceptable risk, and there are many examples of this, especially college sports, for example, in the US. So with that in mind, if you have a look at what we did at World Players, as we kind of went through this return to play discussion from about March to June last year, what we did was convene a number of exchanges with our affiliates. We worked really, really closely with them to support their negotiations. And we developed a series of guiding considerations for what we called a safe return to work and play. And this highlighted a number of key features which are still relevant to the ongoing challenges we face today. One of them was rigorous negotiation and consultation. For example, the establishment of return to play committees, where you would have representatives of the players, representatives of the leagues and government bodies, and it would be their job to go through the information and collectively agree to the decisions that needed to be made. There was widespread consultation across sectors. Our affiliates were talking to epidemiologists, they were speaking to infectious disease physicians, they were speaking to public health officials, they were getting all of the best information to make sure that when sport came back, it was going to come back in a way where, as far as possible, athletes were going to be protected. This then led to a number of protocols, and as Hannah said, and as was sort of picked up before, sport now looks very different. We've had things like daily testing. We've had modification to PPE. In locker rooms, you're in very confined spaces. As you go out onto the field, you're in very confined spaces. We had to make sure there was proper ventilation, that the air was clean. Travel arrangements had to be changed, so on. We also had to sort of review the collective agreements to make sure that if an athlete were to get COVID, they were going to be protected from those risks. There was some sort of discussion that, athletes, they're young, they're fit, they're healthy, COVID's not really going to affect them as much. But our experience was that we did have players who contracted COVID and they were quite badly impacted by it, and we had to make sure that they were going to have the proper insurance and care sort of available to them. And then on top of that, there was this whole mental health discussion. Once again, Hannah spoke really well to that. But it's not just mental health for the athletes, Mary, it's also mental health for the family and the friend of the players. Players in hubs, for example, are going extended periods of time without being able to see their family. So they needed support as well. And the player associations have played a role there, offering support to the family networks. And, I think one of the final points I will make is sports is one of the few industries where there's a 100% injury rate. We're worrying about COVID here, but there's all sorts of risk whenever somebody steps out onto the playing field. So we had to make sure that the ordinary medical treatment and care available wasn't compromised as part of the return to play process. And I think the final point I'm going to make here was, once we've done all that, we had to keep on learning. This hasn't been a static pandemic. No matter what happens, we need to have a plan B. We need to review the measures, and we need to make sure they're responding to the relevant challenges. So it's kind of an overview of some of the issues we responded to.
I'd like to bring in Stefan, to this discussion. Stefan, the impact of COVID was significant, and we've talked a lot about the impact on sport for those who are participating, right, athletes. But you're trying to prepare and deliver the World Cup in a matter of months. COVID hits. What happened? What was that like? And how did you respond to it? Take it away, Stefan.
Thank you, Mary. I'm pleased to be part of today's panel discussion at the Sporting Chance Forum. Just some background on the Worker Welfare Department to put the audience in scope. The Worker Welfare Department within the Supreme Committee was established as a dedicated legacy program to enforce our worker welfare standards. Now, these standards are contractually binding with our contractors, which have been developed to ensure health and safety of our workers on our program. Workers' welfare has always been a priority for the Supreme Committee, or the SC as we call it here. We are committed in utilizing this one-in-a-lifetime tournament to make a difference in creating social change for migrant workers in the country and in the region. Throughout the COVID-19 pandemic, we have strengthened our commitment even more to protect our workers and to navigate this unprecedented challenge. Allow me to give you a quick overview of our COVID-19 crisis management strategy, or our plan, if we go to the next slide. Let me introduce you to the construction scope, which will help you understand the reach of our COVID-19 strategy and the workforce benefiting from this. Since 2014, our work covers construction of 7 new stadiums and 1 upgrade of an existing stadium, and the construction of 17 non-competition venues. At the peak of construction, we had over 30,000 workers on site. Currently, just over 13,500 workers. During the peak of the pandemic, 2020, we had 23,000 workers on site. With that amount of workers on the ground, we knew we had to act quick and to ensure our workers stay safe and to reduce the spread of the infections. If we go to the next slide. Our approach in tackling COVID-19, right from the onset of the pandemic, the Supreme Committee, or the SC senior management, worked closely with the Qatar's Ministry of Public Health to ensure proper implementation and recommendation of safety guidelines. We didn't wait to be overwhelmed by the COVID-19. Instead, we took a proactive approach and managed spread. And we acted on 4 critical areas. One is risk assessments. We focus on Supreme Committee accommodation sites, catering facilities, most importantly, workers at high risk. These included workers with chronic diseases and those above 55 years of age, Around 396 high-risk workers were temporarily demobilized or transferred to a consolidated accommodation where they received proper medical care, as well as receive all their benefits and salaries. The second critical area, which was maintaining a close communication with workers. We conducted awareness sessions with our in-house health expert, as well as 1,300 well-being interviews and assessments were conducted to help workers cope through these challenging times. We also utilized our flagship grievance platform, the Workers' Welfare Forums, to engage with our workers and to raise awareness. These forums allow workers to share concerns, raise grievances without fear of retaliation. As of today, over 750 online forums have been held so far. The third focus was welfare inspections. Again, it's one of the mechanisms in our standards. We leveraged on the existing audit and inspections system to monitor the implementation of the COVID-19 safety measures. Daily inspections were carried out across the SC construction sites as well as the accommodation sites to ensure hygiene and sanitation of all site clinics, social distancing among workers and staff, and strict compliance to our safety guidelines. Since March 2020, we have conducted 397 site inspections and over 8,442 task-specific inspections, which relates to COVID-19. The fourth area we focused were isolation measures in the early 2020. So with the guidance and approval of the Ministry of Public Health, the Supreme Committee established a 1,000-bed capacity isolation facility where we treated workers infected with COVID-19. This enabled us to monitor and maintain strict quarantine protocols, as well as to minimize the spread of infections. The facility was managed by licensed doctors from the Ministry of Public Health. And on the 13th of August 2020, the facility was closed down following a significant drop in the number of active cases. A total of 785 workers were successfully treated in this facility. If we go to the next slide, it just gives you a snapshot of the measures that I just spoke about, which were implemented as part of our crisis management plan. They were definitely successful in delaying the spread of infections for up to 6 weeks. After the first case was identified in Qatar, we introduced additional measures to augment our safety and well-being protocols. One such important undertaking was mental health, and Matt spoke about it as well. We undertook a mental health campaign for workers, which I will talk to you on the next slide. If you can go to the next slide, yes. Mental health, you can go one slide back, Elizabeth. Mental health, now we have always focused on mental health as one of our focus areas in medical and health. As part of our pre-mobilization process, workers undergo a medical examination through which we identify underlying health conditions. This also includes the GAT-7 and the PHQ-9 assessment, which identifies general anxiety as well as depression. We further intensified our focus on workers' mental health throughout the pandemic. The Supreme Committee immediately collaborated with the Ministry of Public Health and the mental health services at Hamad Corporation, Medical Corporation, to develop a COVID-19 awareness campaign for workers. This campaign focused on stress, depression, anxiety as well, social isolation, well-being, and physical health of the workers. The content was translated into multiple languages, and we shared it with over 18,000 Supreme Committee workers via SMS as well. Utilize again our worker welfare forums to send it out to all the workers. We have also shared this with 15 local embassies representing the highest number of migrant workers in Qatar to be passed on to non-SC workers. The content was uploaded on an awareness app, which reached also 207,000 residents. The impact of our strategy, COVID-19 strategy, if we go to the next slide. As a result of the proactive strategy, we were able to promptly address this COVID-19 pandemic and minimize the impact on our workforce. As I mentioned, we leveraged on our existing framework, such as audit and inspection systems, healthcare infrastructure, which definitely expedited our safety response and helped us to establish this strict guidelines. We engaged with our workers, we kept them informed, we kept them updated. We had good protocols in place, and throughout the pandemic, we have tested over 4,166 workers. Over 1,687 workers were tested positive, which were treated in the various facilities. Since the nationwide COVID vaccination campaign was initiated, we have made sure that our workers are vaccinated as early as possible. As of today, we have 15,363 fully vaccinated workers. To conclude, COVID-19 pandemic definitely been a challenge for us all. We thank the Qatar leadership for the strategic efforts that has helped flatten the curve of frontline workers and to reduce the impact of the pandemic across the country. Our workers are and will continue to be our priority, and we are doing the best we can to ensure their safety. I hope these few slides gave a better understanding of what the Supreme Committee did in terms of COVID-19 safety measures.
Terrific. Terrific. Thank you, Stefan. So we're going to do a speed round of some questions now, and I'm going to ask going in reverse order of how you just presented. So Stefan, I'll go back to you. So those who are listening today, right, you outlined several protocols and steps that you took. For those who are about to or are in the middle of preparing to host a sporting event, large or small, in their city, right now, what are your top 2 or 3, pieces of advice that you have for them in order to, take advantage of what you've learned?
Yeah, I think coming to terms with the scale of COVID-19 pandemic and understanding the impact on operations and the day-to-day life of migrant workers, we took the approach right from the start and introduced a number of health and safety programs, being proactive, strong relationships with your contractors. Communication is important, strong communication channels, prepare for the unexpected, be comfortable with change. I think this is a opportunity. This is a stressful situation, so we have to be comfortable with the change. And what we have realized is the value of technology. And I've spoke about how we conducted communication and worker welfare forums with our workers. The value of technology, making sure your systems is resilient enough to handle all these changes. Lastly, taking risk assessments to the next level, plan properly, do your risk assessments properly, and expect the unexpected. Qatar has acted swiftly and pragmatically and to reduce the impact, but it's important that you stress test your systems and ensure you have a strong collaboration with your stakeholders. Complacency, there's no room for complacency on this.
Sure, Stefan. One of the things talking about risk assessments that I think was so interesting was you proactively identified who were your high risk category of workers pretty quickly, right?
Yeah,
so you were able to zero in on them.
Yeah. We had the medical program. Like I said, we do a full medical examination of our workers prior to be demobilized or mobilized to site. And that gave us the information, and we had the data available of who our risk workers are, and we could identify them and then look specifically after them. That gave us the edge.
Okay, terrific. Matt, I'd like to come back to you. So same sort of question, key learnings. For those leagues who are now, right, we've learned a lot, you've mentioned some things. What pieces of advice do you have for those who are planning, league play returns, with respect to, being able to protect and ensure workplace safety for athletes?
Yeah, thanks, Mary. I think the simple message is embrace the expertise of the players. When you negotiate with the players, history has shown that, the outcomes are better not only for the athletes, but also for the sport. I mean, I think the quality of the people some of our affiliates have been working with has been so high, it's actually gone on to inform public health policy. I can point to the NFL, for example, where the data they collected informed the CDC, the Centre for Disease Control's revised definition of a close contact. I mean, that's the level that these affiliates are at. I also think just to sort of pick up on Hannah's point before, where she spoke about the Olympics and some of the frustration associated with the preparations and the lead up to that. I mean, I think everybody was happy that the Olympics could ultimately be convened and completed, but I think there are a number of areas of best practice where it could have been improved. I think we saw some concerning examples of the fact that athletes had to sign waivers, for instance, whereas I spoke before about how in our leagues they're entitled to insurance and compensation, they're going to be protected from the risk. Some of our sports had very effective contract tracing type mechanisms. The hotel isolation, I think at the Games we saw some really concerning examples of where athletes were actually confined. And, it's important in those sort of scenarios to make sure the athletes are kind of having the proper level of comfort and care. And then once again, the mental health support, that's another area where player associations provide a lot of expertise in terms of player development and wellbeing professionals to sort of help athletes when it comes to this very foreign, very strange, very kind of cold and sterile sort of environment, and also in other matters, I think especially ventilation, for example, and these sort of points. So there's a lot to learn from engaging with player and athlete associations when it comes to COVID.
Terrific. Thanks, Matt. And what I think is interesting is the role of ventilation, right? I mean, we're seeing more and more that PPE is critical, hand washing, important, ventilation, absolutely critical. As well as PPE when it comes to preventing the spread. For Hannah, I'd like to go to you. We've had a question in from the audience, and I was going to ask you a question of my own, but I think I'm going to go to the audience. And the question is, I'm a footballer myself at the amateur level. I wonder what advice you can give to an athlete to preserve his or her mental health during the pandemic. And do you have any of what you've learned or what you've done that's really helped for your own well-being?
It's a good question. You know what? I think the first step is important is like when you feel overwhelmed or like just really fed up, really own that and feel that and know that that's perfectly okay to feel that way. That's the first step, I think, because we know that this is a raging virus, so the priority is obviously like people's health, of course, but mental health, as a sort of collateral damage of the virus, needs to be treated as an equal crisis because it has impacted athletes, of course, but like everyone as well. So first thing, just acknowledge that, and that's very rational. That's okay for you to feel that way. I think acknowledging that for me was good for me to be like, okay, it's fine to feel like this. Okay, the next step is just to think, okay, what is in my control? Because in the end, it's all about what you can control. If you can't control it, you're just going to drive yourself crazy. And so I think what I did is I've been doing a lot of ball work, just individual skills work, which I thought, okay, this is good because this is an area that I need to work on anyway. So now I have the time to do it and work on these weaknesses. So you can start to identify what you can control and then try and piece out like the positives as a result. And that can actually kind of get you through, a period of time that's maybe made you feel purposeless and unproductive, but kind of flipped it and said, actually, I'm working on weaknesses in that respect. That's kind of how I tried to work it. When I was in hotel quarantine and I had to just be on a bike every single day, I thought, okay, of course I need to be on the pitch playing with my teammates, but at least my knees are getting some good, my quads are being worked, and I'm getting a good support from my poor knees that I've damaged over the years. I tried to really think of things that, like, at least I can do this now. I have the time to do this now. Because essentially a small silver lining, I guess, is that you are given a lot of time suddenly. Maybe not the time that you want to, it's time that was taken away from you and things that you wanted to spend it, in different ways. But if you can flip it and identify it as time that's been gifted to you to work on other things that you wouldn't have done anyway, that's how you can kind of reframe that. So basically just focus on what you can control, stay in shape in any way possible, because that's really good for your mental health anyway. And work on your weaknesses. That's what I did.
That is such a good answer. Super constructive, super helpful. So I have a question for the entire panel now, for each one of you. How would you like to see sport organizations, mega sporting event, organizing committees, awarding bodies, so interpret it however you want, right? How would you like to see sport organizations build back better from COVID, right? So the build back better question. Matt, you've mentioned that it exposed existing inequalities, made it worse. But now there have been bailouts, right, to bring back live sport. There's now been, various measures taken financially to get the sport industry back up and running. But as we're doing that, what advice do all of you have on how you'd like to see sport organizations build back better from COVID? So I now, maybe I'll go to Stefan first. Stefan?
I can talk from a worker welfare perspective. The takeaway I would give is make sure your department, your corporate environment has agility and adapt quickly, quick decisions, as well as making sure your systems is resilient. If you cannot have the resilient systems, it will take you much longer to cope with what is still coming.
Terrific. Thanks, Stefan. Matt?
Yeah, thanks, Mary. I think, as I mentioned before, this was actually one area we did a lot of work in. We actually developed what we call recovery and rebuilding principles to actually support the industry build back better. And there were kind of a few key elements that we emphasised as part of that work. The first was, a united industry-wide response is essential. Coordinated, urgent action by all stakeholders actually working together. The second point was, the need for immediate relief for those areas of the industry which have been particularly hardly affected, but that's got to be matched with a kind of long-term vision and industry plan. For too often in sport, we've had a lot of short-sighted and short-term decision making, and I think, the pandemic is an opportunity to sort of reevaluate that. The third point, and this is something I've spoken a lot about, was, emphasising freedom of association and collective bargaining. I sort of spoke before about where athletes weren't well represented. They were exposed to unacceptable levels of risk. We then talked about, supporting player development, wellbeing, mental health. And, what's really important in this conversation is fully committing to women's sport. Women's sport has really made significant progress prior to the crisis. We cannot any longer stand by and let it be deprived of its full potential. And I think, the final point I want to make is really the need for heightened financial transparency and good governance. It was quite remarkable that after decades and decades of sustained economic growth, that as soon as this crisis hit, the industry was almost brought to its knees. I think, as Stefan said before, there should have been more resilience within the industry, and that can be supported by good governance.
Yep. One of the things at the center that we looked at was, particularly for economic assistance that was provided to the sports sector, that that be provided to both bail out all aspects of sport, not just elite men's professional sport, but also women's sport, sport with persons with disabilities and so on and so forth, particularly if it involved public money. Hannah, over to you. How do you feel sport can build back better given what you've seen with the pandemic?
I think just to acknowledge Matt's point, it is a really good point, is not to let the momentum of women's sport, women's football, in particular, die out. That really needs to keep going, and we can't let like this pandemic sort of dim that, because that is like crucial progress. And so that was a really good point. But also I think what this pandemic has done is it's highlighted the how important it is, mental health, how important that is for athletes in particular. And so I think it's having conversations like these, it's having discussions like these and continuing that, let's not let those conversations disappear, and like recognize that this has been really tough on a lot of people, and the impact has just been huge. And to remember that and recognize that, okay, we are, mental health is so important. It's basically like the fundamental way that we exist. You can't really exist without your mind, essentially. So I think, just keeping that in mind and moving forward and continuing to have these discussions. I feel like it's important to feel like you're as an athlete myself, I'm feeling seen, I'm feeling heard with how this has gone. And so that's all thanks to having these discussions. And so just to keep that kind of going is really important.
Well, you mentioned once before was, normalizing this discussion around mental health, right? Mm-hmm. When someone says, how you doing? You could get back, actually, I'm not doing okay at all, right?
Right. Yeah.
Right. So being able to have an awareness that when that's the answer, what then? No, I'm actually not okay, right?
Yeah, exactly.
Okay, terrific. So I'd like to now offer each one of you some closing thoughts. What would you like to offer the audience on your thoughts around as they go to do their work on prevention of COVID, either for hosting an event or for return to play? Stefan?
The COVID-19 pandemic provided a stress test to any system within the corporate environment, and you needed to be successful in your program. Again, coming back to risk assessments, I can't emphasize that more. Emphasize on risk assessments, communication. We talked about mental health. Act swiftly and pragmatically to reduce the impact of pandemic, whether it's COVID-19 or any other pandemic, and ensure you have strong collaboration with your stakeholders, contractors, every step of the way, and make them part from the beginning.
Great point. Matt?
Yeah, thanks, Mary. I think I've made a lot of the points that I'd like to sort of emphasize, so I won't repeat them, but as we sort of sit here, particularly in Europe, and we're kind of getting back to what feels like some sort of normal, I think we have to be pandemic prepared. I think this probably won't be the first pandemic to shock us. We can't let the lessons of this crisis be quickly forgotten. And I think there's really an opportunity here for sport, being a global industry, to actually share information, set best practice, and foster collaboration, which can kind of be useful for society as a whole.
Terrific, Matt. Hannah?
I guess like the biggest thing that I've kind of just had to learn is just to be learn to adapt and just really control what you can. Like just focus on that, like let go of what you can't control. And hopefully, moving forward, there will be a little bit more contingency based sort of restrictions around sport, like, collective training lockdowns where you're locked down and kept, separate, but you're able to keep training. There's contingency based sort of setups for athletes specifically that really do need to be training properly, not stuck inside a room for 2 weeks, So those lessons learned moving forward should be good. But overall, I think we just have to control what we can.
Well, and creativity, right? I mean, where there's a will, there's a way. So it might not look like anything we've ever seen before, but is it possible? right? To mimic some sort of training environment, right?
Yeah, exactly. Yeah.
Well, terrific. Well, I'd like to thank our three panelists for this fantastic and important conversation. Please carry on the conversation on the conference website and on social media using the hashtag SCF21. We're looking forward to seeing you at the next session, starting shortly at 2 p.m. Central European Time on mega sporting events and respecting worker rights beyond compliance, where we're pleased to be joined by speakers from Intel, the ILO in Qatar, and the World Federation of the Sporting Goods Industry. Thank you all for tuning in, and we'll see you shortly back at 2 p.m. Central European Time. Thanks, everyone.
Thanks, Barry.
Thank you, Mary.
Thank you.